So like these treatment cases that I'm going to show you is like these were what I was planning on showing to my provider to kind of give him overview about the effectiveness I've seen of like MSE. So this is like cases from Dr. Mariana Evans, the full expansion of the maxilla here, and then this is CBTC scans, and then this is the Dr. Lipton case that you showed in your videos. So like, you think it's a good idea to like show my potential provider all these images, or like what should I go and tell the provider to kind of have the most optimal chance of like potentially getting the treatment? Because I would rather get it first in Canada because I'm insured and everything, and it'd just be a big cost saving. But I just want to get your thoughts on that.
So I never really advocate really kissing up to doctors and convincing them to treat you. I think
Yeah.
that it's hard enough to get treated by a doctor who's enthusiastic about treating you and optimistic about them giving you a good result. So in general, I wouldn't do what you're doing. I would just find another way to get treated by someone who wanted to treat me. But that being said, I think any reasonable MSE provider should be aware that sleep disordered breathing exists on a spectrum, and
Hmm.
it's not black and white. It's not either sleep apnea or perfect breathing. And if you could demonstrate that, and he should know just by looking at you and that high vaulted palate that you probably fall somewhere on the spectrum, I would really focus in on that and say, hey, look, maybe bring in some snore lab results, maybe bring in results from a sleep study that show some amount of UARS,
Yeah.
and say, hey, look, I'm not looking for a perfect result. I'm just looking for an improvement in my nasal breathing. Here, listen, and then show him how your nose is blocked, and then just rely on his power of reason to know that the MSE is going to widen the nose. It's going to improve the airway in several different ways. And if that doesn't convince him to treat you, then it's time to move on.
Yeah, got it. I actually didn't think about it from that angle, providing the actual snore lab results. That's good. Because I understand that a lot of these dentists, orthodontists, providers, whatever, they rely a lot on quote unquote like objective data. Like I don't see like the problem with that, but